To matters health, in a move that could help reshape the global HIV response, the nearly 100% effective HIV prevention tool, lenacapavir, said to stop HIV in its tracks, will be available in over 100 low-income countries by 2027, paving way for the access to the generic versions of the twice-yearly injectable pre-exposure prophylaxis and, as Gloria Milimu reports, a landmark agreement between Dr. Reddy's laboratory, a generic supplier, and United, Clinton Health Access Initiative, and WITS RHI will now see the drug retail at 5,000 shillings, down from the initial 28,000 US dollars, translating to 4 million Kenya shillings per person per year. Take a look.
The global HIV response continues to witness remarkable transformation in the wake of the ongoing efforts to end HIV as a public health threat. At the center of these efforts is the reduction of the cost of a HIV prevention drug, said to be a game changer in stopping the virus in its tracks. The long-acting injectable pre-exposure prophylaxis, known as lenacapavir, would have been out of reach for millions of people who struggle with daily oral pre-exposure prophylaxis pill, stigma, or access to health care. However, it is a reprieve for low-income countries following a multi-partner and multi-supplier deal that will see the cost of the first-ever twice-yearly injectable PrEP product reduced from 28,000 US dollars to 40 US dollars per person annually. Meaning, by 2027, those at high risk of HIV infection will be able to access the WHO-recommended jab at 5,000 shillings annually.
The people who need it the most are those people hiding from the law, gay men, trans women, who could come out just twice a year to get their injection and be safe. It is young girls and young women in Africa who are the most vulnerable to HIV.
The pricing breakthrough has been termed as a much-needed step towards ensuring accessibility to medicines across the world. The jab that received WHO backing in July 2025 has the ability to protect someone for 6 months with a single injection at the same cost as the current available daily pills.
The announcement of the price of the generic at $40 per person per year for the injectable brings it to the level that countries and communities have asked in order to unlock the demand and attain the levels of protection that are needed.
Originally developed by Gilead Sciences, the injectable lenacapavir comes at a time when the world witnessed at least 1.3 million new HIV infections in 2024, with disproportionate impact among key populations. In Kenya, where at least 20,105 new HIV infections are reported annually, the pricing breakthrough will go a long way in preventing new infections among populations at risk of HIV. At least 13,000 of these new HIV infections are reported among the female population. Meanwhile, as efforts are also directed towards regional production in the future, experts say by driving prices down and securing sustainable supply, generics will make 6-monthly PrEP a real choice for millions of people in need in low and middle income countries. Gloria Milimu, KTN.
The suspected human trafficker arrested for recruiting 20